Next few minutes, I am going to tell you about management of hypertension, that is high blood pressure in diabetic patients. We know that diabetes and hypertension both are lifestyle-related diseases, which we see very often in our clinical practice. So, if the high blood pressure in a diabetic patient, if it is not managed, if it is not properly managed, it leads to complications. Complications in the sense, a diabetic patient with high blood pressure can end up with cardiovascular events. He will get into the problems related to complications of diabetes. So one has to control diabetes. One has to control hypertension. So to control hypertension in a diabetic patient, we have got two measures. One is non-pharmacological method, and second is pharmacological method. If you come to this non-pharmacological method, everyone knows that salt restriction will reduce the blood pressure to some extent. So a diabetic patient with high blood pressure should restrict the intake of salt. And second one is exercise. About 50 to 60 minutes of exercise, at least 4 or 5 days in a week, will bring down blood pressure in a diabetic patient. And third one is weight reduction. Weight reduction will bring down, what I mean to say is 1 kg reduction in weight will bring down the blood pressure by 2 to 3 millimeters. So I told you salt restriction, regular exercise, and weight reduction. These are the 3 main non-pharmacological measures in the management of hypertension in a diabetic patient. Once you come to pharmacological management, the word pharmacological management means use of drugs. We have got 5-6 group of drugs in the management of hypertension in a diabetic patient. Among these available anti-hypertensive drugs, ARBs are the best in a diabetic patient with hypertension. So ARBs should be the first line of therapy in the management of hypertension in a diabetic patient. If with ARBs blood pressure is not under control, we can add CCBs, calcium channel blockers. So the combination of these 2 drugs will bring down the blood pressure. In a diabetic patient, we have to avoid beta blockers as much as possible because these beta blockers will mask the hypoglycemia. So I told you about pharmacological and non-pharmacological management of hypertension in diabetic patients. In addition to this, proper control of blood pressure blood sugar is a must. So any diabetic patient with hypertension should control his blood sugars also. And stress. A diabetic patient, we know that diabetes and hypertension both are stress-related diseases. Once the stress level comes down in a person, automatically blood sugar and blood pressure will come down. So simple pranayama is known to reduce blood pressure in diabetic patients. Thank you. Namaste.